Mr. Debiprosad is an employer channel head and focuses on healthcare. He's a passionate, result-oriented professional with 25 plus years of experience in educational training, certification skills, employment domains with specialization on talent development, retention and progression, talent sourcing and mobilization, L&D product development and solution implementation, client management and engagement. He will walk us through today's session. Over to you, Mr. Debiprosad.
Thank you and namaskar to everyone. It's a privilege of ours to represent our foundation, especially the work that we do across the globe, helping the youth and the workforce to be more professional, to be more productive and more result oriented. I'm sure all the personalities are here. They all and the panel personality, they have all explained the importance of having the talent retained with you and create a kind of progression path for the talent so the talent can continue working with you. So because talent draining out, it's a big loss for any organization. With that, we'd like to work with you. We are being a global philanthropic organization. We offer every services to you completely free of cost. So it is for the society and we help the society, the industry, and healthcare today is one of the most promising industry in the country. It not only helping lakhs and people to save their life, serve them. At the same time, we actually working with people like you to help you to develop the workforce to become more competent, more customer centric. I was going through the panel discussion and whatever I heard that it's very important to show the basic characteristic like empathy, a better customer communication, and people are talking about nowadays not a patient, we never say patient, we say customer, client. So that way the entire healthcare, and you know better than me that it's shifted from a service to an industry. So I would like to request Vivan, should I share the screen or will you share the presentation? We have a small presentation. We'll show you how we can work together. We can develop a collaborative environment so that we can work together hands in hands and help the healthcare organizations, healthcare hospitals and other services to develop their workforce better. So my sincere request that whenever you have a question or doubt, please stop there because we are here to with a request to collaborate. And how we can collaborate in a very philanthropic manner. As I said, for each and every service, what we provide is just focusing how we can help the industry, how we can help the youth, how we can help the workforce. So we are actually approaching today with two solutions. One, typically for the healthcare HRs, which is that how we can impact the critical behavioral traits, the critical qualities, which can actually help to make our workforce a winning workforce. They might be healthcare staff, they might be management staff, they can be our official staff. So that is what we called as a 21st century employability program, impacting the critical skill set. And another that we'll talk about specially for your technical staff, the healthcare staff, which we call the healthcare domain program. So a little about our foundation. We work in 20 countries across the globe with a mission to make youth having a kind of sustainable livelihood so that they can grow in the industries, they can progress in the industry, they can actually take their career as well as the industry they are going forward in a growth path. So the opportunity that I am representing is especially focused on how we can develop the skill set of the workforce. So the workforce skill set is exactly the area that we are working with it, and we are working with esteemed organizations like yours in different medical sectors. We have started working with a couple of big hospital chains. We started working with different testing houses and other hospitality institute, even who are producing professionals, the healthcare professionals. So with that, I would like to tell you the main offering of ours. We can divide our offering to you in two different categories, two different baskets. The very first basket, as I told, it is more for the HR and the workforce development, the general workforce development, which is critical behavioral skill development. We have three offerings into it. We have a program which can empower their internal behavioral skill. make them a better professional through job rise. There are only 32 units. Each unit will be something around 40 to 45 minutes, digital, self-learning based interactive module. And second one is Shine at Workplace, which makes them ready for the next level of growth. So Job Rise will definitely help them to increase their retainability. They will find values what they're doing. They will find a future growth path, and the Shine at Workplace will actually make them ready, make them more mature to take the further responsibility. That means actually indirectly making them ready for a growth. And if a person see his growth, if a person find that he has a career, he will never leave your organization, and you will be a retainable, effective, productive workforce for you. At the same time, as all the hospitals are having both the genders, so POSH is, I think, is a compulsory for any hospital or healthcare organizations. Prevention of sexual harassment is a compliance from Government of India, and we are very happy to say this program we have developed with ISTM, Government of India. It's a Government of India program which we also can offer for your entire workforce. All these three offerings comes completely free of cost, digital, interactive, and it get delivered through digital platforms. So there is no physical classes required, and the people can do it anywhere, anytime within a stipulated time frame. And after completing that, they will be graded through online evaluation. If they clear the evaluation, they will get a joint certificate from your organization and our organization side. For the second category, who are the direct healthcare people who are actually treating the patient, starting from your reception, starting from your billing counter, starting from the people wherever they are interacting with the with the patient or the client. Here we have got three programs. One is healthcare communication, because as you know, in healthcare organization, communication is very different. As it has been told many times that empathy and this kind of thing should come, the politeness, even how do you break a bad news, also a big challenging issue for a new joining or maybe a person who are working for 1 to 2 years time. Then comes down the general duty assistant, and this is also a big workforce, part of your workforce who actually help the nurse and the doctors for doing their operations. They're very critical part. So you have a very focused technical program for them, and then a phlebotomy assistant. So these three programs we call as a domain program. These are technical, validated content. These are also digital. These are also self-learning, and all this program that you are seeing is basically gamified, and it's actually based on the cartoon characters. And each cartoon characters will play a real-time healthcare case study. So when they are teaching something, they will take a real-time hospital issue, problem, or challenges, and then it will teach that how these challenges can be overcome, and to overcome these challenges, what are the quality or the knowledge the person should have. So these are the two broad category offering for us. One is the critical behavioral part, which improves the behavior, the teamwork, the client orientation, client centricity, problem solving, this kind of behavior. And another is a domain, which is completely technical. And to go to the behavior part, we have programs. We have done a thorough research across India, talked to different industry, including healthcare industry. We met their HRs, we met their directors, and understood that what are the challenges they are facing. And with that particular kind of research that we have done across with 1,104 companies and different verticals, we find that in healthcare, if you see the left-hand side graph, 53%, if I say 100% is the area of focus, 53% focus remain on the what we called as a life skill, the soft skill, the interaction, customer centricity, problem solving, this kind of behavior, which the industry named as a employability behavior. So 53%, it means the person, he can be very good technically, but he might not be a person effective for a hospital if he does not have this particular qualities. So we have a program specially designed considering the feedback from all HRs, their inputs, which covers 10 critical skill set. And in a very simple manner, in just a 2 months time, in a bootcamp, self-learning mode, we impact your workforce to develop the skill set. And once they develop each of these skill set, they will be a better professional. So each skill set they complete within this program, they will go one step to become a better professional. They will be offering a better service. They will create more customer delight. And once they will provide better service, customer delight, management will be happy. If the management will be happy, they will be happy. So entire ecosystem, we can create a win-win-win. Win for the employee who has improved himself and retained his job. Win for the management who get a quality, improvised and improved professional. And win for the entire customer who are getting, or the patient community who are getting better services, better care for the money that they are spending for. And as you see, it can be done in just spending 30 minutes a day. So the people, the participant, the workforce, they need to take their mobile and just watch these videos, the cartoon movies, 30 minutes a day. And that 30 minutes also not continuous 30 minutes. They can do sometime the break of their work for 10 minutes in the morning, 10 minutes in the afternoon, and maybe after going home or while traveling back to house, using traveling through a train or metro or bus or car, they can watch the rest. So 30 minutes, 10, 10, 10, or maybe 5, 15, 10, whatever the way they would like to manage, anywhere, anytime. Within a week, they need to complete a stipulated number of modules. And this way, we will communicate with you, we will sit with you, we'll make a kind of charter for you. Generally, we do it in a 2 months boot camp, where without disturbing their current work, their current pressure, simply using half an hour and giving them a very digitally interactive AI supported platform, they will be learning this. And about that domain, we have got some brilliant program which can help your workforce. And these programs are technically validated. So we have got 2 programs. One is the GDA, where we cover general duty assistant, we cover healthcare communication, 13 lesson, and we cover healthcare HES, which is the environment and safety. So this way, we cover another program called phlebotomy, where we cover the phlebotomy, which is around 15 lesson, healthcare communication, 13 lesson, and healthcare HES, environment and safety. And these 2 programs can also be customized. So maybe in a certain hospital, like we are currently working with a very premier hospital called Hamdard Institute of Medical Sciences. So they are actually conducting both the programs for their trainee nurse and the nurses and the healthcare staffs. So they are actually giving them 1 by 1 lesson. They started with communication, then they have given them the GDA part, and now they are giving them the phlebotomy part. So this all program are digital, interactive. It does not require regular classes, only it will be a weekly connect to clear their doubts, which can happen for 30 minutes, 40 minutes in a time that we can discuss and find out the mutual time, and an intro class at the beginning for 1 hour to explain them that how they can use this platform. So we provide a complete digital platform hosted in Amazon Cloud, so they can access from their laptop, desktop, mobile phone, tab, and whatever, with a decent mobile connectivity. So you can see the platform, and it's a live platform. So when we meet for a discussion, maybe 1-to-1 with you all, so we can definitely give a demonstration. We can plan a joint program to develop the workforce together. And in this platform, every participant will get a login and password. And end-to-end, again, I do repeat, there is no monetary involvement. Wadhwani Foundation does this for the society, for the benefit of the industry, without charging any remuneration directly or indirectly. And another part is that you can see the line here, that we keep the data security the top priority. So whichever the people who will be logging into the account, this account will remain completely secure, so that no data of one hospital is getting exchanged with anybody else. Even there can be hospitals who are having their own learning development platform. So in some cases, we also, if the number of participants is quite high on a regular basis, then we can actually put a kind of single sign-on between the 2 platforms and ensure that you get a absolutely smooth support always. So you can see this here, everybody will get a login and password, and they can access both the programs. The programs comes down in a very digital interactive video-based manner. So they will watch a video first to understand the concept, then the video will actually push the person to think with the different quizzes. Then they will do a collaboration, take a real-time hospital problem and solve the problem using what the learning they got in the watch and think. And then they can test whether they have learned it. They will have some quiz. They can give the quiz and find that whether they have been able to clear that case studies or not. And everything is case study based, and each case study is only from the healthcare domain. And the explored part is the additional knowledge if they want to acquire. And this way they will be doing, you can see a glimpse of the test which is there. So multiple choice case study based. So a story will be told in a real time hospital environment. And then there will be option given, how do you react? Maybe in future when we meet one-to-one, we will give a demonstration. Even if any one of you are currently interested, can share your detail in the detail with our team, and we will definitely reach you, because it's a complete support end to end. It's not only nurturing, guiding, mentoring, everything. At the same time, we come out with a complete solution of developing your workforce. As I told you that the self-learning mode, they will watch this video, cartoon-based interactive, watch, think, do and explore mode. And weekly, there will be a connect of 40 minutes, 45 minutes to see that if there is any doubt or not. And that can be also kept in a suitable time, which does not disturb their official hours or the peak hours. And this way we actually complete the program in around 2 months, 2.5 months time is a boot camp. But yes, time we can do reduce or increase depending on the pressure of the people or the need of the organization. As I told you that watch video generally 5 to 8 minutes video, think video is around 5 minutes, do the part where they can evaluate themselves is around 20 minutes, and export is not compulsory. They may do it, may not do it, it's 10 minutes. So total learning will be around 30 minutes for each unit. And there are only around, as I showed you, that there are a couple of units depending on what program that you would like to choose for developing your team. This is a kind of convocation. So once this is done, we will do a digital convocation with you and all your staff members. We'll be making a digital, joint certification, and we will organize a digital convocation so that they can be also awarded. This is one of such convocation we did with a food giant called Testified in Pune, and this has happened through digital convocation. They have around 48 executive got certified. It's a small program, but they completed in 2 months for the retail and food and beverage section, but not healthcare that way. And there are for the HR program that we have for the development of the critical behavioral skill, we also provide a scorecard which help the HR and the management to understand the macro and micro level performance of the behavioral skills of the employee. So suppose you want to put a lady member in the grievance cell or the customer care cell, and the person does not have active listening skill, then what will happen? There will be a lot of conflict happening, a lot of dissatisfaction getting created. So this kind of scorecard will automatically get generated when the particular employee is doing this program, and without letting anybody know, that scorecard gets generated, and we share this with the HR so that and the participants, so that they can improve their area of concern and utilize the area of strength. So these are the leadership. Our foundation is founded and headed by Dr. Wadhwani. He has also been awarded as Padma Shri last year. Dr. Ajay Kela is our president CEO, and our operations here is led by Sunil, whom we have already met in the panel discussion. We are working across India, over, you can say, around 2 lakh students are currently ongoing, around 700 hours of content that we have, and we are having 14 countries doing the same. In India, we are working with almost all vocational trainers, the universities, the employers. You can see we are doing a programs with medical equipment and other companies like ThyroCare. We are doing a program with Excellence, and as I just said, that we have started a program with Hamdard Medical Institute, Hamdard's Institute of Medical Sciences and all. These are programs that are happening across the globe, just a glimpse of that. and definitely we work across. So I like to stop here, and I would like to seek your feedback. If you find that there is a need of working together, we are very, very happy, and we're very eager to join hand and develop your workforce together, because what we do believe that if a very strong healthcare services in the country, not only we can save life, it can be a wonderful avenue to earn foreign exchange for our country, because healthcare is going to be one of the very, very premier business and business vertical for even earning a foreign exchange. Even I am from a part of Eastern India, I can see a lot of people coming from places like Bangladesh and Sri Lanka and other places in Eastern India's hospitals. Even you can see the South hospitals, they are all flooded with patients from abroad. So it can also be a very business, but at the same time, we need to keep on upgrading our workforce.
So reimagining the patient experience, building the hospital brand, and attracting more patients. These are the two sessions that we will have next Wednesday. I now thank all our partners, Esosham, Vintyo, Cyient, Riz Telangana, and Voice of Healthcare in coming together for Transform Health. And I also thank everybody for taking out time today and joining us today. I hope you found the sessions interesting, and there is much more in store every Wednesday. Look forward to hosting you all.